Dr. Amina Yusuf arrived at the WHO headquarters in Geneva early, ready to review the latest global vaccine shipments. She led the Global Vaccine Distribution Integrity Unit, responsible for monitoring vaccines reaching clinics in over 50 countries. Her team oversaw Plague Shield X, a breakthrough vaccine developed to protect against pneumonic plague Yersinia pestis, a deadly disease that could spread rapidly if uncontrolled, with historical mortality rates exceeding 50% in severe outbreaks. The vaccine was highly effective but extremely temperature sensitive, requiring storage between 2 to 8 degrees Celsius to remain potent. Even a few hours outside this range could render doses useless. One morning, Amina discovered troubling data. A shipment of 1.2 million doses bound for West Africa had been exposed to elevated temperatures for several hours, putting millions of lives at risk. Her deputy whispered a tempting shortcut: just adjust the spreadsheet. No one will notice. It would hide the problem temporarily, save embarrassment, and avoid operational delays. But Amina's stomach tightened. She knew the stakes were enormous. If ineffective doses reached hospitals in Ghana, Nigeria, and Burkina Faso, millions of children and adults could remain unprotected, allowing a regional outbreak to spiral uncontrollably. The plague spreads rapidly through respiratory droplets, and pneumonic cases can overwhelm hospitals in days. Refusing to compromise, Amina acted immediately. She traced the error to a cooling unit failure. At a warehouse in Accra, Ghana, her team coordinated rapid deployment of backup freezers, recalibrated all sensors, and rerouted shipments through monitored air freight. Amina prepared a transparent report for WHO leadership and the vaccine manufacturer, clearly indicating which doses were unusable and which required urgent replacement. Within hours, corrective action was underway globally, preventing any compromised doses from reaching patients. Thanks to her honesty and swift action, millions of doses of Plague Shield X reached clinics safely. Outbreak clusters were contained and lives were saved. Had she chosen to falsify the data, hospitals could have administered ineffective vaccines, resulting in thousands of severe infections, overwhelmed health systems, and potentially triggering an international health crisis. WHO leadership praised her courage, noting that transparency under pressure preserved both life and trust. Amina's example became a global lesson in integrity. Short-term convenience may hide problems temporarily, but honesty ensures effective action and saves lives. Her work strengthened global confidence in Plague Shield X, prompted stricter cold chain protocols in more than 30 countries, and proved that integrity at the individual level can ripple outward to protect millions. The story of Amina Yusuf reminds the world, doing the right thing is rarely easy, but it is the choice that can prevent disaster, save countless lives, and inspire trust across nations. In global health, transparency is not optional, it is life-saving.